It is my pleasure to introduce our speaker. Dan has been kind enough to return to share with us this time about carbon monoxide. Dan's a supervisor of the Indoor Air Unit at the Minnesota Department of Health. He's been with the Indoor Air Unit since 2001 and has a Master of Public Health degree from the University of Minnesota. The Indoor Air Unit conducts research, education, and outreach concerning indoor air quality, especially radon, mold, and carbon monoxide. Unit staff also regulate smoking in public places, air quality in enclosed sports arenas, and radon professional licensure. Welcome, Dan. The floor is yours.
Thank you for having me back. Presented on radon and mold a couple months ago. I think most of you were on that Zoom meeting. And today I want to talk about another indoor air hazard we deal with, which is carbon monoxide. I'll share my screen. So can you see my PowerPoint now? All right, can you see my slideshow?
Perfectly, yep.
All right, thank you. So I think I'll hold questions till the end because I'm not a Zoom expert, but whenever I use Zoom and PowerPoint, all I can see is the PowerPoint slides and 4 people's camera feed, so I can't see the questions. So I'll wait till the end to answer questions and then we can talk then. So we at the Health Department, we deal with 11 types of topics and hazards related to healthy homes. Radon and mold, which I talked about a couple months ago. Carbon monoxide, which I'll talk about today. Those are the topics we focus on in my unit. We also at the Health Department deal with asthma, asthmagens like allergens and irritants, lead in paint and other materials that can cause damage to our brains, especially in young kids. Asbestos, which can be found in materials like insulation, pipe wrap that can cause lung cancer, mesothelioma, and asbestosis. We deal with drinking water, and about 20% of the population is on well water in Minnesota. There can be pollutants like nitrates and bacteria in our well water, so we can test for that. And cities also test for contaminants in water too, and you can always check with your city to see what's in your water. We deal with pest management a little bit and advising and educating, dealing with chemicals and pesticides. We do some education around ventilation and filtration, which can help reduce contaminants. And we do establish some standards for chemicals such as volatile organic compounds found in paints and products. And my agency also deals with injuries in the home like slips, trips, and falls. And we do some tracking of that and some education and outreach. So in a nutshell, that's what we deal with. There's obviously other types of hazards that can be found in and around homes and other agencies like labor and industry, public safety, fire marshal, PCA. There's a lot of different agencies that deal with different types of hazards in and around the home. Today I'm going to talk about carbon monoxide. It's often called the silent killer because you can't see it, can't smell it. You won't know you're breathing it unless you can recognize the symptoms, which are easy to overlook. But it can be stopped with a carbon monoxide alarm, also called a CO detector. So my main takeaway for you today is to make sure you have a carbon monoxide alarm 10 feet of every bedroom in your home. Make sure it actually works. You can test the siren feature. There's a test button you can press to see if it'll sound the alarm. However, if it's an older alarm, like if it's more than 7 years old on average, it may be ready to be replaced. So if you're not sure, I just replace it. They're about $30 at the hardware store. So if you're not sure about the age, it's always best to replace it. So just what is carbon monoxide? So it's a very simple molecule composed of a carbon atom and an oxygen atom, as you see in this graphic. And it's very, very similar at a molecular level to oxygen, because oxygen is an oxygen atom and another oxygen atom. So it's virtually identical at a molecular level to O2 or oxygen. You can't see it, you can't smell it, can't taste it. It's produced when things burn. So anytime something is burned, whether it's a cigarette, firewood, leaves, gasoline, natural gas, any combustion is going to produce some amount of carbon monoxide. And the issue is in our homes is if your appliances aren't working properly, they're not vented properly, they're leaking, then the carbon monoxide can build up and sometimes to dangerous levels. Now, carbon monoxide is about the same molecular weight as oxygen. However, in our homes, typically, it's hot. Like when it's coming out of your furnace because there's a leak, or your water heater, it's going to be warm because it's a byproduct of combustion. So because it's warm, initially it'll be lighter than air and it'll float up through the room. And then as it cools and mixes, it'll be at about the same density as air, and it'll mix and distribute evenly throughout a room. Why is this important? Well, because it could be higher in your basement to begin with, but then it'll mix and move up the house through the warm air rising through the house, due to ventilation mixing it up, and then it'll mix pretty evenly upstairs. So that's why you can have your CO alarm down low in an outlet, or you can have it up high, unlike a smoke alarm, which always needs to be up high at the ceiling. Across our country, carbon monoxide affects a lot of people every year. About 400 deaths have been reported. About 8,000 to 15,000 ER or doctor visits occur every year nationally. These are probably underestimates because sometimes it's undiagnosed, sometimes it's not recognized, and the symptoms can be confused with other illnesses. We're also concerned about possible low-level carbon monoxide exposure under the levels that cause serious symptoms, and this might damage our heart in particular and contribute to heart disease. So even at levels where you might just have very mild or no symptoms, there could be slight effects on our heart muscle and heart tissue. Closer to home in Minnesota, we've been tracking CO effects since 2000. So during this 18-year period, we averaged a little over 300 ER visits, a little over 33 hospitalizations, serious illnesses and complications, and about 14 deaths per year. Now, we do think these numbers are underestimates. Number one, again, because carbon monoxide poisoning is often overlooked or misdiagnosed. And number two, because these stats don't include Minnesotans that have been treated in hospital.
I think he froze for a minute here. Give it a second. Which we probably look frozen to him. That's the irony of when it freezes. My girlfriends and I were doing a Zoom and she froze with her hands up like this. So that became our symbol of somebody being frozen, as you just everybody put their hands up, frozen. Uh-oh, Dan. Well, I'm guessing he's gonna log back in here in a second and we will catch up. I don't know about you, but carbon monoxide and radon, all of these like invisible toxins, like, you wonder how many more there are that we don't know about, or just amazing.
Well, and because we're all home, these are becoming more, these are certainly a lot more important for us to be aware of because we're in our homes 24 hours a day these days.
I have a friend who had a horrible, terrifying experience. Her carbon monoxide detector, I think it didn't go off. She was in a townhouse and apparently somebody in the garage, which is like, within the units, was committed suicide in the car in the garage with the car running. But that carbon monoxide went throughout the whole building. And it was like divine intervention that she woke up and grabbed her daughter and like they could barely crawl out of the house and they ended up in the hospital, and just like scary, scary stuff, I mean, we have fewer and fewer of those now that we know more.
Well, I don't know about all of you, but I have been noticing that the Minnesota Department of Health has been doing a lot of public interaction and outreach. I've been seeing news stories about radon and carbon monoxide quite a bit, and maybe just because I know that Dan's coming to speak, so it's like I'm looking for it. But whether it's real or perceived, I'm noticing it. So I think they are I think there has been a concerted effort, and if Dan can rejoin us, I'll ask him about that.
Mm-hmm. Well, it's nice that detectors now are both smoke detectors and carbon monoxide, and that sophistication, I think, is pretty cool.
So has anybody, speaking of air quality, has anybody heard that the outdoor air quality is bad right now, that there's an inversion layer? Because it seemed like when I was driving that it smelled a little bit.
Oh.
Tell me about an inversion layer.
Well, sometimes it's typically in the winter where bad air is trapped, and so it's like smog.
Oh,
It's rare here.
Sorry about that.
that's okay. Glad to have you back.
We've been having trouble with my MDH VPN today, so let me just resume.
That's state of Minnesota wide, Dan, because I'm a state employee as well, so VPN is having a problem today.
Yeah, it's rare that we have that. It just so happened to be today. Is my screen still sharing?
No.
Okay, let me do that again.
We're in business. Looks good.
Okay, I just need to switch over to slideshow. All right, so we also see more poisonings. I was talking about how men have more poisonings than women. We see it in seniors at higher rates, maybe because they have underlying heart and lung conditions, maybe don't respond and react to the symptoms as soon because they don't realize what's occurring. Also, we see more problems, of course, during the heating season when we run our furnace and other heating equipment. So the way carbon monoxide affects us is we breathe air into our lungs normally. And if there's carbon monoxide in the air, that enters our lungs and it goes into the bloodstream. And because carbon monoxide is virtually identical to oxygen, it can actually attach to our blood cells, to the hemoglobin in our blood cells, and it is much more sticky, if you will, to our blood cells than oxygen is. So it tends to kind of barge its way in, knock off the oxygen molecules, and attach to the hemoglobin. And then the red blood cells carry this carbon monoxide instead of oxygen, and our body can't use carbon monoxide for, you know, the metabolism that we need the oxygen for. So it's called a simple asphyxiant because you're basically starving your body of oxygen, and the organs that are most sensitive to oxygen depletion are your brain and your heart, and that's where the health effects occur. So the signs can include breathlessness, difficulty breathing, it can include nausea, dizziness, because of the neurological effects and the lower oxygen being delivered to tissue. If you continue to breathe carbon monoxide, it can continue to confusion, irritability, impaired judgment. So there's some ways to tell if it's carbon monoxide versus, say, influenza. A lot of people get the two confused. And if you feel sick at home, feel better away from the home, it's probably something in your home environment. It could be carbon monoxide. If everyone's getting sick at the same time in your home, it could be carbon monoxide because of the flu or any virus is going to go from one person to another, and they're going to be at different progressions of the disease or the flu. Also, your pets, your cats, dogs can have carbon monoxide poisoning. They're not going to get influenza. And with influenza, you can have a fever and you can have body aches, which you would not have with carbon monoxide poisoning. Now, anybody can get affected by carbon monoxide. It's basic physiology. It's oxygen depletion, basically. And at long enough exposure, at a high enough exposure, you're going to be sickened by carbon monoxide. But some people might react sooner. For example, if you have a respiratory condition like asthma, COPD, where you're already struggling to bring in enough air, now you're not bringing in enough air because you have carbon monoxide, you might experience symptoms sooner. If you have heart disease, other lung disease, if you have anemia, meaning your blood cell doesn't efficiently transport oxygen, you might be at greater risk and have symptoms sooner. And certainly elderly and young children may react sooner. The elderly, because they're more likely to have these heart and lung conditions and blood conditions, and the younger because they tend to breathe more in, actually, pound for pound. So they get a higher dose and respond sooner to carbon monoxide. So we think about homes and furnaces and water heaters, but carbon monoxide poisoning can occur in other places. For example, on our boats. We had a tragic incident about 10 years ago now on Lake Minnetonka. A young girl went downstairs, down into the sleeping area on their boat, lay down for 15 minutes and was poisoned and passed away. And this girl's name was Sophie, and Sophie's Law was passed a few years later. So now for the last couple of years, it's required on larger boats to have carbon monoxide alarms. It's a good idea, even if it's not required, to have a CO alarm in your boat, but generally boats with galleys, accommodation areas like kitchens, bathrooms, now are all required to have CO alarms. Another concern can be when we tow passengers. When you're tubing, jet skiing, you want to make sure there's sufficient space. You also don't want people to hang out by the engine while they're in the water, while the engine is running. That can be an exposure too. We've had problems in ice houses where people have gotten poisoned while they're ice fishing. Unfortunately, sometimes the heating equipment, the space heaters, are not working properly or they're not vented right. So it's important to pay attention to that. It's also a good idea to have a CO alarm in our ice houses. They're not required, unlike boats where it's required. In ice houses, you're not required to have one, but it's highly recommended that you have one that you can plug in that also has a battery backup or just a battery-powered one. Portable generators are another specific area of concern. When the power goes out, people will use a portable generator. Sometimes they run these indoors, in their basement, in a garage, in a carport. Maybe they're concerned it could get stolen if they leave it outside because they're not cheap. Or maybe people are just unaware about the potential risk. So we do see problems, especially in the South. It seems like, unfortunately, after every hurricane, every major tropical storm or major ice storm, a few days later, we see the reports of people dying from carbon monoxide poisoning from portable generators. It's really important that we move these at least 20 feet away from the home. You can chain them, you can lock them down to something so they don't get stolen. And there are also a few newer models now that do cost a little more, but they have CO sensors. So if the CO reaches a high level around the generator itself will automatically shut off. So look for that as a feature. Most generators don't have that feature yet, but I think in time we'll see more and more of them have that feature. And of course, don't forget about your cabin. If you're renting one, if you own one, you stay at one, sometimes we don't put as much money into these homes, or we don't heat them very often, so the system may not be working as well. It's important to have alarms in our cabins and make sure that they're working and that there's a battery in them. So another concern we can have in Minnesota is idling cars. You know, it's recommended to not idle your car anymore. You know, 30 years ago, it was recommended that you warm up your car before you take it out. It's really not necessary anymore with modern engines. Sometimes people will idle the car just to warm it up, right? You don't want to sit in a cold car. If you're going to do that, be sure to back it out and do it in the driveway. It's a big source of carbon monoxide, and idling it in your garage that's attached, even with the garage door open, that may not be enough. In fact, it could push the carbon monoxide into your home and cause a poisoning incident. There are other, of course, tools and appliances we might use in our enclosed garages. That's a bad idea to use your charcoal or gas grill in your garage or other power tools. Again, take it outside, take your snowblower out into the driveway when you're going to burn off the gasoline in April, you know, when you're done with the snowblower. Make sure you're doing that outside. So in our homes, our boilers, furnaces, water heaters must be vented to the outside with a chimney, or technically called a flue. Fireplaces, wood burning stoves must be vented out. Kitchen ranges should be. Some kitchen ranges have a hood over them and they're ducted out. Many do not. It's a good idea not only for combustion byproducts that include carbon monoxide and particulate matter, nitrogen oxides, but also for carbon monoxide. So it can help keep a cleaner indoor air. Clothes dryers should be vented out. Like you see in this picture, it's being vented just into the room. That's a bad idea because, number one, you're dumping a lot of humidity into your home. But number two, if it's a gas-powered dryer, then you're also dumping carbon monoxide into the room. So make sure those are ducted out. And in our bathrooms, we should have working exhaust fans, not for carbon monoxide, but for humidity, which, like I said in my last presentation, high humidity can cause condensation and mold problems. So when you look at your water heater and your furnace, if you see some signs of problems, bring a qualified technician in. You might see rusting. If the system is not venting out and the air is coming down the flue, there's also a lot of humidity in that combustion byproduct, and that can cause condensation. That's why you might see rusting around the top. If you see, you know, those blue tags on top, if those have melted, that would indicate a problem like backdrafting. If you turn it on for the first time in October or November, your furnace, you see a lot of condensation all over your windows. That's an indication of backdrafting. Orange, yellow flames, discoloration on the appliance or outside at the top of the chimney. Those are all visual indicators of a problem that should be checked out. Now, sometimes we have problems in our homes after air sealing to tighten up the home or weatherization, or if you have a kitchen remodel and you put in a big, powerful exhaust fan, that can cause air to be pulled out at a higher rate than what's naturally coming in to the home. And we call this depressurization, where more air is leaving than coming in, and that can cause backdrafting where air gets pulled down your water heater or your furnace, and the carbon monoxide spills into the indoor air. You may recognize this from your basement. Hopefully you have this combustion makeup air duct. It might be kind of silver, it might be kind of a black plastic tube. It's about a foot wide, maybe 10 inches wide, and it's there to bring in fresh air into your basement if your basement basically doesn't have enough air. If there's a backdraft, depressurization, this duct will make up the air that's gone missing from your home. And so it's important that that's there. You don't take it off, you don't tie it off. It's necessary there to protect you and make sure your atmospherically combusted equipment have enough air to work properly and safely. Now, in newer homes, and also when you replace your furnace, you should be getting a sealed combustion system with direct air. So this is safer than the older furnaces because it's not pulling air from the basement. It's pulling air directly from the outside through a PVC pipe, and that goes into a sealed combustion chamber. And then the combustion byproducts, the pollutants, go out the side of the house. So this is generally safer than older furnaces, and they should have a shutoff mechanism. So if it's blocked, if it's covered with snow, it should shut off automatically. But if it's not shutting off automatically, and if you have a crack in your combustion chamber, there could be a problem. So it's important when there's a big snowfall or if there's drifting snow against your home to go out to the side of your home, check to see if these are blocked or covered and to clear it out. Otherwise, number one, you might have a CO problem, but number two, your furnace is going to turn off and then you're going to be cold in your house. And that's another problem. We do recommend having a furnace tune-up and check-up done periodically, such as annually. This might identify problems that could lead to bigger issues down the line. They should check to see that the fan and the motors are running properly, that there's no signs of CO problems. They might measure for CO, and you should ask for that. It might help the system work more efficiently and save you a few dollars. So it is a good idea to have this safety checkup done, and these are often marketed like in September, October, you'll see the commercials for these checkups, and they might charge you $80, $90, $100 to do that. Of course, I have heard reports of some contractors being unscrupulous and trying to sell a furnace. So if you do run into something like that, do get a second opinion to see if you really do need a furnace or if it can be repaired or adjusted and you can keep using it. So carbon monoxide is not the only pollutant that's produced during combustion. When you burn things, you can also produce small particles and nitrogen oxides. These can affect your lungs. They can cause asthma and affect your lung and heart. And also humidity is produced when you burn gas. So the carbon monoxide alarm will protect you against carbon monoxide. It may or may not turn on if there's a particle problem or a nitrogen oxide problem. This is where the annual furnace tune-up and checkup is useful for your water heater and your furnace to make sure these other combustion byproducts aren't an issue in your home. Let me talk about CO alarms now. So they are required now for I think about 15 years approximately in all homes. You need to have one operational CO alarm at least in your home. You may need more than one home if you have bedrooms spread out on different levels. So the requirement is that there's one within 10 feet of every room lawfully used for sleeping. So like an official bedroom under building code. So it might be enough to have one CO alarm. You might need another one if you have bedrooms upstairs and you have bedrooms downstairs. You'd need another one for the downstairs bedroom. This is required by code. They cost about $30. And obviously you should do this to protect yourself and protect your family. When you look for an alarm, be sure it has the UL certification. So like you see here, it's a U and an L with a circle. I've never seen a CO alarm sold in a hardware store, at least not in a long time, that is not UL certified. So all the hardware store ones, I've never seen a report or an incidence, but I have seen online vendors, including Amazon, including eBay, that were selling these for a while, and then once they realized, they shut them down. But they have been sold online that are not certified, so be sure to look for that when you buy them. They should last about 5 to 10 years. If you're not sure, or if you know that they're older, replace it. It's not something to mess around with or take chances on. I do like the digital model like you see here. The digital model should show a 0 at all times. If you see anything other than a 0, even if the alarm is not going off, and it should not go off if it's just like 5 or 10 ppm, the alarm, the audible alarm should not go off. But if you see any reading, you should have it looked into. It could be a false reading. These devices are not that sensitive, but you should still have a technician come and check out your furnace and water heater. So these CO alarms are designed to alert you to an emergency, that something is happening right now that could kill you. They have standards under the Underwriter laboratories to avoid false alarms, meaning they're not at a significant level that could really cause serious health effects. The point here is the alarm doesn't go off all the time where then the person just ignores it, and when it's a really significant issue, then they don't take action. So they're set at pretty high levels to go off. They can't go off at 30 parts per million. At 70 parts per million, they have to go off after an hour, but no later than 4 hours. And at higher concentrations, they have to go off sooner. But again, these alarms are set up to go off at high levels, not at low to moderate levels. And if you want more protection than what a standard CO alarm can give you, you can purchase a low-level CO monitor that costs a couple $100, and you can program that to go off at a lower concentration, like 20 or 30 parts per million, to give you an early indication of a problem. So let me just recap and summarize. Carbon monoxide is a colorless, odorless, and tasteless gas. You won't know you have a problem unless you somehow recognize the symptoms or if your alarm is going off. The symptoms are easy to overlook. They can be similar to the flu, influenza, headache, dizziness, nausea, fatigue. Some of the major differences are your pets can get CO poisoning, but not the flu. With CO, everyone's going to be sick at the same time, and you'll feel better when you leave your home. Problems are fairly easy to prevent. Virtually every CO problem that's ever happened could have been prevented if there's a working CO alarm, if equipment are maintained, operated, and installed correctly. And as an additional precaution, we would recommend an annual checkup and tune-up just to be safe. Here is our contact information. You can also just do an internet search, Minnesota Department of Health carbon monoxide. You should find our website. You can always call us. You can email us with questions. You can read more on our website. And that's the end of my talk. I'll open it up to questions.
I have a question.
Yeah, go for it. Go for it.
We were discussing while you were gone, Dan, that the smoke detectors often have a CO detector in combination. Is this required, or how do we tell if we've got smoke detectors installed? How do we tell if it includes CO also?
Yeah, it should be really obvious. I actually have one in my house, and it should clearly label it on the alarm. It should say CO and smoke alarm. So if it's not clearly stated, then you should assume it's probably just a smoke alarm. And then you should also go purchase a carbon monoxide alarm. The smoke alarms are required. There's a lot more requirements for smoke alarms. You need to have one on every floor, and you need to have one in each bedroom as well. Whereas with CO alarms, you just need to have at least one within 10 feet of every bedroom.
We bought our house in Golden Valley a few years ago, and we have a 50s house. It has 3 flues going up, 2 fireplaces, and in the basement, we have an indoor charcoal grill. Now that's got to be a crazy scenario. We have put a TV in front of it, but I can't imagine an indoor charcoal grill being a good thing.
Yeah, I've never heard of that. So that was installed, was it by you or the prior homeowner?
It's original to the house. The
Okay.
3 fireplace flues going up, a gas fireplace, wood burning fireplace, indoor charcoal grill.
Yeah, that doesn't seem like a good idea because charcoal
No,
can produce a lot of
not a
carbon
good idea.
monoxide. I mean, I suppose there may be a way to engineer a system with a lot of ventilation, but because you're opening it and closing it to cook your food, and there'd also be a lot of smoke. So yeah, sounds like you're not using it, which is a good idea.
No, I just thought it was very bizarre.
Yeah, I've never heard of that being built into a home before.
Dan, am I noticing it because it's true, or am I just perceiving it that it seems like the Department of Health is putting out a lot of content right now related to carbon monoxide, related to radon, and is that, and if that is true, is that because we're at home now for so many hours of the day?
So with radon, we get a federal grant from the US EPA, and we pay for a staff member's salary. We also pay to buy test kits, and we also pay for a mass media marketing campaign. So in January, February, part of March, you'll probably see the ads on TV. You might see billboards on the highway. You might hear it on the radio. So we have a multimedia radon advertising campaign. For carbon monoxide, we don't have a budget to do that. But we do some basic education and outreach like on social media. But there are other agencies that do awareness campaigns around carbon monoxide, like Department of Public Safety, DNR. So it's possible they're doing something and you may have seen something from them.
Well, I know that after you presented, I think I'm remembering October was when you were with us, maybe for the radon presentation. I feel like it was last fall. We did share out your video to a lot of the local Facebook groups, and it got quite a few views, quite a few reactions. So you definitely helped spark some conversation here, at least, and we'll do the same with this presentation as well. So hopefully we'll get that information out for you.
Thanks for sharing that. I appreciate it.
People
yeah, I've been.
I have another question. Excuse me. Does a geothermal heating system reduce the incidence of CO poisoning?
I think it would. I don't know a lot about geothermal systems, so maybe someone here can explain it better to me. But I don't know if they I know they rely on the natural warmth of the soil, the ground, right? And that's an efficient way of warming your house. I don't know if they use some natural gas as sort of an extra auxiliary heating when there's not enough heat being derived from the ground, but I think it does. And if there is any combustion occurring, there's always some chance of carbon monoxide problems. So you should still have a CO alarm. You know, there are some cases where a home may not have any combustion equipment whatsoever. And if a geothermal system does not have any natural gas or propane or combustion, and if your water heater is electric and everything else, your dryer and your oven's electric, technically you can request a waiver from the CO alarm requirement. But I would still recommend you have a CO alarm, just because sometimes people will bring in new equipment and forget about it. And they might bring in a space heater or portable generator, and then you could have a problem then too. So I guess the first step with any geothermal heating is it combustion powered? If it is, I mean, if there's a backup, then there certainly could be a CO potential there too.
I have a question. This might be outside your area of expertise, but I'm thinking when you used to go into the office that you were down the hall from the outdoor air quality people. And I noticed today when I was running an errand that there's an inversion layer and it smelled a little. So I looked it up and it said we're yellow for a couple days. Do you have a sense of, and yellow's not really a source of concern for health. Do you have any sense of how often we are yellow versus green?
Yeah, that's a good question. It's a little outside my expertise. I do know the main concern is particle pollution. In Minnesota, when we have inversions, it can happen in the winter. It can happen in the summer when there's, in the spring, when there's fires, like the dry grass catches fire in Minnesota, and then the summer, forest fires to the west in Canada and in the US Rockies, that smoke can drift over. So usually when we have a bad air quality day, it's related to particle pollution. And you're right, you know, yellow is sort of like a caution. Maybe if you're sensitive, like you have asthma, maybe you would want to reduce your outdoor activity. Talk to your healthcare provider about that. I don't think we really have CO problems in the outdoor area. I think occasionally we have ozone issues, but I don't know the number of days off the top of my head. I think the PCA does produce an annual report that they post, the Pollution Control Agency, that they post on their website. And it would be in that report, so you might want to check that out. And if it's a topic you're interested in, you know, consider bringing a speaker in about outdoor air quality from PCA, or even MDH could help out maybe.
Good questions. Any others? Well, thank you, Dan. I feel like we get a little bit healthier or smarter about how to be healthier every time you come and visit. Thank you so very much. And this presentation is being recorded, so we send this out to other Rotarians if they would like to watch it. So the message very well will go farther than the small group that you see here.
Great, thank you, appreciate it. And if you know of other groups that want a live presentation like this, let me know or have them contact me.
Sure thing, thank you. And as we close today's Rotary meeting, we're going to recite the four-way test of the things that we think, say, or do. First, is it the truth? Second, is it fair to all concerned? Third, will it build goodwill and better friendships? Fourth, will it be beneficial to all concerned? That concludes today's Rotary meeting. Stay healthy, everybody. Nice to see you. See y'all next week.
Thanks, Dan.